line and on the ballot this November. Donald Trump and his enablers in the House and in the state houses are out to take away all of our health care. They want to repeal the Affordable Care Act in the middle of a pandemic. They've grossly and routinely and every day mismanaged the coronavirus response. They want to gut Medicaid and starve Medicare. And the people who on our first panel and our second panel are the people who are really standing in their way and have fought to keep our health and our health care for all Americans. Because left to the president, he'd be siding with the insurance companies and the drug companies, lavishing them with tax breaks and giving them special favors while leaving the rest of us to suffer. Today, we'll hear from two panels. Our first, you see on the screen with me, Speaker Pelosi, the Attorney General of the state of California, Xavier Becerra, and former HHS Secretary Kathleen Sebelius. And they're going to answer for us and for all of you watching a simple question. What's at stake in this election? What's at stake for healthcare in this election? What's at stake for you and your family? And why is this choice so clear? Our first speaker, the speaker, is, as you all can imagine, quite busy. President never seems to stop trying to ruin the nation, and she's stepping up to all of that. She needs no introduction. I just want to give her, on behalf of all of us, just the largest thank you I can muster. We would not have an Affordable Care Act without her. We would not have fought off Donald Trump without her. She works tirelessly every day for the people. And thank God she does what she does for all of us every day. We know, Madam Speaker, that you'll need to run, but thank you for joining us, and the floor is yours.
Thank you very much, Leslie, for your very generous remarks, which I will accept on behalf of the House Democrats for their courage, their commitment to healthcare as a right, not a privilege in our country. And I thank Protect Our Care for being so much a part of it, because internally, as our distinguished guest here, Mr. Becerra, Attorney General Becerra, and Madam Secretary Sebelius can attest, our inside mobilization is inside maneuvering is essential. But without the outside mobilization, we cannot achieve any great thing. And Protect Our Care has been so much a part of initially passing the Affordable Care Act, but then saving it. Working with you and Adam Hoyer, who has been just wonderful being on our calls every week with the grassroots on this. We had 10,000 events around the country when they were making their assault on the Affordable Care Act, 10,000 events of people telling their stories. And without those stories, which were so compelling, I don't think we would have prevailed. Attorney General Becerra was there, present at the birth of the bill, and now our champion in saving it in his in the Congress, in the country, and in the court. So thank you, Attorney General, for your leadership, and Kathleen Sebelius, laser focused on making healthcare right, not a privilege, whether as Governor of Kansas or as Secretary of HHS, and now across the board. So here we are. It is when we won in 2018, just not to talk politics, but civics, healthcare was the issue. It was the issue. And that was before the coronavirus. Now, even more so. And you, Leslie, thank you again for the leadership of Protect Our Care, but you mentioned the postal system. That's a health issue. 1.2 billion prescriptions were delivered by the postal system in 2019. Almost 100% of veterans' prescriptions are delivered from the VA by the postal system. And again, it is something that people depend on, and now they have reacted to. So again, they're also, because of their assault on the postal system, affecting the choice people have to make between their health and their vote come election if they can't vote by mail. But getting back to the Affordable Care Act, we were very proud of it, and we passed the enhancement of the Affordable Care Act with even more benefits and more opportunities at lower cost for more people. And then we passed H.R. 3, which was the promise in the campaign to lower healthcare costs by lowering the cost of prescription drugs, but doing so in a way that enabled the secretary to negotiate for lower prices. The president said during the campaign that he would, President Trump, that he was going to negotiate like crazy for lower costs. Like crazy meant not at all, not at all. Just pulling his punch and giving away the store to the prescription drug industry. So again, in June, the House passed the Patient Protection and Affordable Care Enhancement Act. This is what we promise as we go forward. We'd love for the president to join us now, but in 78 more days, we will have elected a new president, and we'll be continuing to write legislation that expands what we did in the Affordable Care Act, that has some additional benefits, but also opportunities for people. And we look forward to working with you, Protect Our Care, to not only pass it, but to formulate what it would be, listening to the story, seeing what the priorities are. And we'll do so with President Joe Biden and Vice President Kamala Harris in the White House, and that will make all the difference in the world, literally and figuratively. And it will make a difference in the health and well-being of the American people. So I thank you, Protect Our Care. I cannot thank you enough. I thank you through Adam Hoyer practically once a week because your outside mobilization made it all happen. President Lincoln said, public sentiment is everything. With it, you can accomplish almost anything. Without it, practically nothing. But you helped develop the public sentiment that made all this possible. And we couldn't be more fortunate than to have Javier in the position that he is as as Attorney General of California. How proud we are of him. He knows in detail the bill, but more important than that, he knows the impact on California. So as he leads us in the courts on this, it's just a blessing from God, in my view, that he is there. So thank you, Javier, for your courage. And Madam Secretary, thank you for continuing to beat the drum on all of this. Again, from your governorship to the Obama administration. And I thank you. Leslie, I thank you for your kind remarks. Again, I accept on behalf of our House Democrats who are very courageous in all this, but also with great praise for President Obama. He led the way on all of this. He was an inspiration. It was a joy to see him in action. As the Secretary can attest, he knew the details of it all, and he could be the head of state leading us with such values and know the specifics of the legislation and how it affected people. So in any event, we have a lot to be grateful for. We have a lot to protect, and we have a lot to benefit from this election when we elect a stronger House, hold the House, win the Senate, and elect Joe Biden and Kamala Harris, President and Vice President of the United States. Thank you so much for the opportunity to share some thoughts with you.
Thank you so much for being a speaker for the people, for passing the legislation you have on healthcare, as you mentioned, and for everything else you're doing to keep us safe and the country.
Thank you, Leslie.
And we know you have to go, so.
Thank you. I'm sorry that I do, but I'm glad we could make some time together. Thank you.
Thank you. And I hope everyone who listened takes every word to heart.
Thank you.
Our next speaker is Attorney General Becerra, who, as the speaker indicated, was there for the passage of the ACA and now is safeguarding it in the courts from this disastrous Trump lawsuit that's looking to destroy the entire law in the middle of this pandemic. The Attorney General has been leading the fight. He's been corralling all the other attorney generals and working in full cooperation and doing a great job together. I think, Attorney General, as you described this, a lot of folks, who are listening and who we talk to, this seems like an arcane court case. It's not something to really pay attention to, but yet it is the pure evil of this administration. And if it is successful, it would be so horrible. So I was wondering if you could, maybe start off a little bit by just explaining why people really need to care about this and what's at stake.
Absolutely will, Leslie. And first, let me thank you to Protect Our Care, all those who've been all this time from the beginning in 2008 forward. And certainly you got to include our HHS Secretary Kathleen Sebelius, who was just a remarkable, I want to say champion, but it was more than a champion. She was on the front lines at the very beginning and all the way through this. So I want to thank her. And you squeezed me in between two potent and dynamic leaders, that between Nancy Pelosi, Speaker Secretary Sebelius. I will tell you, and I think Secretary Sebelius will recognize when I say this, there were more than just a couple of times when Nancy Pelosi pulled the Affordable Care out from the brink of disaster. And we could have easily named this Pelosi Care as we could have Obamacare, because Nancy was so pivotal in making sure it actually became law. I was there. I was in those trenches with her. I was a member of leadership, and I remember that we took to the floor, and Secretary Sebelius probably remembers this. We took to the floor in the House when we were first trying to pass the House's version of the Affordable Care Act. We didn't have the votes, but we took to the floor because Nancy was determined. She said, "We're going to make this happen. We've gone too long." And so I'm thrilled that you would squeeze me in between two potent American leaders who really made a difference. And hasn't it made a difference? Let's put it this way. I came from one of the poorest congressional districts in the nation when I was serving for 24 years. Uh, Today, as a result of the Affordable Care Act, there has been a drop in the uninsured rate among Black Americans and Latinos by 40% since the Affordable Care Act took effect. That's powerful. But beyond that, I think, Leslie, everyone knows that today there are 133 million Americans, millions of them children, who have a pre-existing medical condition, who today, because of the Affordable Care Act, don't have to worry that an insurance company will discriminate against them and say, we don't wish to offer you insurance because of your pre-existing condition. They can't do that anymore. And say they don't have to worry today. There are some 20 million Americans who didn't have coverage before the ACA, who today have it because they either got onto expanded Medicaid or they bought into their own insurance plan through the marketplaces. There are more than 2 million young Americans who are beyond 18 who are still on insurance, not because they bought their own policy, but because they get it through their parents until they're 26. There are tens of millions of seniors today who they don't have to worry so much about healthcare because of our program of Medicare and Medicaid. But today they pay less for their prescription medication because of the Affordable Care Act. And many of them don't pay a cent for their preventative care because of the Affordable Care Act. All those things would be gone for all of those Americans if the president, who's supposed to defend federal laws, which the ACA is, were actually out there doing the right thing. But instead, he's trying to strip away all those protections from the millions of Americans who today can say they can see a doctor without worrying about going bankrupt. Why the president and 18 other states have decided to go all the way now to the Supreme Court to rip away the Affordable Care Act at a time when we are suffering the worst pandemic we've seen in this country in more than a century makes no sense. But that's where we are. And that's why we're fortunate. We will be in the Supreme Court. California will lead that effort. We will do the argument. But it's not just California. There are 20 states and the District of Columbia, our coalition, fighting to preserve the Affordable Care Act, not just for our own people in our own states, but for everyone. And so it is a fight that we will not lose. And as we prepare to enter into court, I could have summarized our brief to the Supreme Court challenging the Trump administration by saying, not on our watch. We're not about to let go of all these successes, all these great victories for so many people, not on our watch. And so that's why we're here. We're going to fight to preserve not just the Affordable Care Act, but to do what Joe Biden and Kamala Harris have said they want to do. They want to build on it because we have more to do. But my God, this is not the time during a pandemic when so many people are losing their job and losing their insurance to go in the opposite direction. So we're ready. We're up for this fight. California, we've had to sue the Trump administration some 95 times. You know, we're there. We're ready. And so, Leslie, to you and to everybody who's there, who's been fighting with us, to Secretary Sebelius, who was just a phenomenal secretary in her own right, but was one of the real centurions in making sure we were able to get ACA across the finish line, and to obviously Speaker Pelosi as well. Thank you all for letting me have a chance to experience some history and make some more still in the future. So thanks for having me.
Thanks for those remarks, and we'll come back to you in a second once we had a chance to hear from Kathleen. As all of our speakers have said, Kathleen Sebelius, Governor of Kansas, first Secretary of HHS under President Obama, was there to make sure that the ACA was passed, and more importantly, to set it off on an incredibly strong foundation. I had the luxury of coming to HHS to serve the secretary who came after Kathleen left, and I can only say the staff she had there, the momentum, the set of values, and the accomplishments were unbelievable. It made it easy for those of us who came in to simply try and follow in her footsteps. And she's kept that fight up every day ever since. She's tenacious. She knows these issues better than anyone, and her values are the values we wish we all had. And so, Kathleen, I hope that you can tell us, in your view, a little bit too. We've talked a lot about the ACA, but not as much about the second threat to our healthcare, which is the president's gross mismanagement of what's happened here with coronavirus, and how these two issues are inextricably related. Because so many Americans rely on the ACA for their care, and to strip it from them now is just unconscionable. But I wish if you could share with us a little bit what you're hearing around the country, why you think this election is so important, and your view of what's at stake.
Well, thank you, Leslie. And I want to start where Speaker Pelosi started and General Becerra already commented a bit. But first, thank you to Protect Our Care. You have been relentless in your defense of the Affordable Care Act, mobilizing people across this country. Javier will remember this well, but the day President Obama signed the Affordable Care Act, March 23rd, 2010, attorneys general sued to declare the law unconstitutional. So this battle has gone on now since 2010, and it is still underway in a relentless fashion. But thank you to Protect Our Care for being kind of the general mobilizing the troops. General Becerra already said this, but it bears repeating. We would not have an Affordable Care Act without Nancy Pelosi. Not only did she manage to pass it once through the House, she managed to pass a very different bill the second time through the House, which was a feat that I wasn't sure could ever be accomplished. And without her tenacity, her resilience, and her willingness to actually put it all on the line, make sure that every member had an opportunity to express his or her views, but at the end of the day knew that the reason they came to Washington was to vote to expand healthcare for all Americans, and that was accomplished. And I have to say about the general, he talks about his current role, which is enormously important. And General, you are my attorney general too, because here in Kansas, we do not have an attorney general who represents my point of view or the point of view of millions of Kansans. So I want to tell you, you've been adopted by the heartland, and continue your battle, not just on behalf of those in California, but a lot of us. But General Becerra was, I would say, Nancy Pelosi's wingman in the House. And every step of this battle to get the Affordable Care Act not only passed, but the implementation process, which took 3.5 years, General Becerra was very much a part of all of those efforts, and they were extraordinary. So here we are. We've had an administration who declared that on day one, the Affordable Care Act would be gone. We are hopefully nearing the very end of that administration, and it's still not gone, thanks to coordinated effort. As General said, there is a very important Supreme Court case pending, and we have the best possible legal team headed by Javier Becerra, headed to make the arguments on behalf of the American public. But right now, not only would the existing people, about 20 million in marketplaces and in states that expanded Medicaid, lose their coverage, lose their ability to be protected with a pre-existing condition, lose their confidence that they won't go bankrupt if they don't have coverage, can purchase prescription drugs so they can stay productive in their lives. But millions more Americans have now lost their health insurance due to the coronavirus pandemic. Losing a job often means losing healthcare, not just for yourself, but for your entire family unit. So there has never been a more important time that people need not only expanded Medicaid, but need the kind of ability to purchase their own coverage with subsidized help Joe Biden and Kamala Harris are the perfect team to begin to implement the correction of this terribly misguided last 4 years. Not only do they want to continue to expand healthcare and restore the Affordable Care Act, which has been sliced and diced in numbers of ways. It hasn't ever been repealed, but it's certainly been hobbled and restricted based on rules and regs put in place. But we need the American public to have confidence that not only will their healthcare not be gone, but millions more will have an advantage to take in terms of expanded healthcare. We just had a vote 10 days ago in the state of Missouri, our neighboring state. The Missouri governor is vehemently opposed to expanded Medicaid and made that very clear. The Republican legislature in Missouri is vehemently opposed to expanded Medicare. But guess what? Medicaid, I'm sorry, in Missouri. But guess what? The citizens of Missouri thought differently. The citizens of Missouri voted to expand Medicaid coverage because they understand in the midst of a pandemic, the worst possible thing is to deny people health care, to deny resources to their rural hospitals, to deny the opportunity for people to make sure that even if they have difficult economic times, that they're not going to lose their health care at the same time. President Obama always said, you can't fix the economy without fixing health care. Never in America have we had that truth more highly visible than right now. We have never had a national plan to deal with the coronavirus because this president refuses to accept any responsibility, as he said himself, no responsibility for this situation. So we've never had a national plan. We've never mobilized the national resources. We've never put the country at ease with national protocols and policies following public health guidance. We are desperate to have new leadership in Joe Biden and Kamala Harris, who will not only restore what has been diminished, but actually put us on the path to finally dealing with the virus. America has done worse than every developed country in the world. People are still dying on this watch. People are still without housing, without supports, without food. We can't send kids back to school safely. We are stumbling from mistake to mistake. And frankly, it is time that we have new leadership. And Joe Biden and Kamala Harris are prepared to lead. So this is a very opportune time, not only just to talk about fixing what was broken, but actually a time where millions more Americans, those workers who have lost their jobs and lost their coverage, people who still are too poor to afford any help and need expanded Medicaid, now is the time to have new leadership and make sure that we can finally not only fix healthcare, but also recover from the virus and recover in the economy, the way that President Obama described so eloquently in 2010. Fix healthcare and you will fix the economy.
Thank you. And as you said, it is how can we fix the current economy when we can't have decent leadership about this virus? It's just simply not possible. I think a lot of people wonder why, when the politics of this issue is so clearly terrible, why the voice of the American people is so clear, why in poll after poll, 80, 90% of people of any political party think pre-existing conditions need to be protected. Think more people need to be covered, not fewer. Want stronger Medicare, not less. Want a stronger Medicaid, as you said, not less. But I would ask both of you, what's your explanation for why politicians who are theoretically sent to do their job for the people and by the people would choose to do this? Do either of you have any explanation for that?
Well, I might start because Javier is likely to be more polite than I am. I think what we saw in 2018 was Republican after Republican after Republican lying about what they had done and what they planned to do. I saw ads running for people who had voted over and over again to repeal the Affordable Care Act, that they believed in protecting people with pre-existing condition. Absolutely not true. Absolutely false. The president has said over and over again, he supports protecting people with pre-existing condition. And as Javier will tell you, the lawsuit would do just the opposite. So unfortunately, we have had a situation where individuals have been able to lie about their records, to cover up what they have done. And more, some were called to task in 2018. I think there will be a more global reckoning in 2020 where people who have sat in the House and the Senate defying the views of their constituents, trying to take away the very health care that their constituents rely on and need, will be hopefully fired by those very constituents at the polls in 2020.
I agree with that. We'll see if we get a more judicious answer or.
Actually, I would sign off on that and put it in my brief. I would only add this, and I think we're beginning to see it perfected by Trump and his allies, and that is politics has always been about perception, right? It's never necessarily been what's actually out there. It's who can make you believe something most. That's how you vote. And at the end of the day, because you can't tell if a commercial's telling you the truth. And when you've got two competing commercials, you try to decide which one you think is telling you the truth. So it's what we perceive. Well, in the case of Donald Trump, he has perfected the art of deception that leads you to perception. And my sense is that they've seen how successful they can be. Donald Trump was impeached, but Donald Trump's allies and his voters still believe that he was wronged. The evidence is there, the facts are there, yet somehow the deception that Donald Trump has sold has become the perception for many voters. And so I would simply tell you that the more they see that this works, since the facts are not on their side, since the law is not on their side, and in many cases the science isn't on their side, they turn to deception. And unfortunately, we're finding that social media, not only did it become the great disseminator of information, but it also has become the great disseminator of deception. And so it's even more incumbent upon all of us to make sure that people get, I won't say truth because it's in the eye of the beholder, right? But facts. And while everyone can share opinions, there's really one set of facts.
Well, Leslie, I would just also say Javier Becerra is going to tell the American public by way of this lawsuit what it is that the Trump administration really believes. Up until now, it's been very difficult, but when they made the very unusual and I think unprecedented move to not defend the law of the land, but go after the law of the land and recommend that the court strike the entire law, they have actually sided with the worst of the congressional intentions, that they no longer can say, I believe in protecting people with pre-existing condition. I believe that we will have a better and cheaper healthcare system. I believe this. They've made it clear what they believe, and I think the general will make those sides very clear in front of the court. And we've never had that opportunity to really clarify what it is that the Republicans believe in. But I think this, for the first time, summarizes it very well.
Fortunately, I think you're right. I want to thank you both. I mean, if anything, this shows elections do matter. And the choice could not be clearer. And it's not just the president. I used to, it's an old saying that people in my family say the fish rots from the head. But that's true here. But it's also the fact that we have members of the House, members of the Senate, who choose, as both of you have said, to lie rather than to tell the truth and protect their people. We have 17, 18 states that have brought this lawsuit forward despite what's happening in this pandemic. And we see politicians willing to look at over 160,000 deaths, 20 successive weeks of people with unemployment filings over 1 million, and still stand by this leadership. So November of 2018 was a healthcare election. My guess is this will be another healthcare election in November 2020. Thanks to you both. Thanks to the speaker. Thanks for all that you do every day and for what you've done today. And we look forward to the rest of this convention, the election, and a very happy January for a nice inaugural in Washington, D.C. Thank you both. And for all of us who are still on, we'll take a break, watch a little video, and then bring in the second panel. Sorry to interrupt.
Angel's trying to get on and Chris is trying to get on.
Hello, everybody. My name is Leslie Dock, Chair of Protect Our Care. Thanks for joining us today and for the second half of our event on the first day of the Democratic National Convention, talking about what's at stake in healthcare. And the panel in front of you today are six tremendous healthcare champions, people who have fought for the Affordable Care Act, fought for the American people, done that tirelessly throughout the last several years, and whose stories and whose work is an inspiration to all of us. I'm going to let them introduce themselves as they answer some questions, and hope that, I'm sure that between listening to them, you will get a sense not only of what's at stake here, but really how the work that's being done out in the grassroots by people like yourselves is making all of the difference in winning these fights and saving our healthcare. So with that, I'm going to really start. I'm going to start with Andrea, and I hope Steve is on. He's not on my screen, but I assume he's there. To really give us a sense of what the Affordable Care Act means for your families. And we know how important the law has been, both in your health and your financial security. Now, I was wondering if you could share some of that, what got you to spend so much time on this, and why it's so important to you and the American people. So, Andrea, do you want to go first?
Sure. Thanks for having us. Well, my name is Andrea. I'm mom to Louisa. She's currently 5 years old, and she'll be starting kindergarten here in Michigan in the next few weeks. Louisa was born, she was diagnosed prenatally with a life-threatening heart condition, where the left chamber of her heart was underdeveloped. So indeed, my baby was born with a pre-existing condition. And this was extremely difficult. There was so much uncertainty. There were no guarantees that she'd survive pregnancy, birth, or even surgery. However, we had a few surgeries that would give her a chance at living a full and happy life. It was a nightmare of a diagnosis because no parent ever anticipates this kind of thing. And fortunately, it was 2014. So we had the Affordable Care Act in place, ensuring that she wouldn't be denied coverage once she was born. We wouldn't have to deal with annual or lifetime caps on the cost of her care. So without those worries, we were just able to do our best to help her fight for her life. And we finally brought her home at 7 months old from the hospital. Honestly, I really have to thank the Affordable Care Act for the access to quality medical care and therapies. And we thank public preschool because Louisa's not only survived, but she's thrived. Last summer, she had her third open heart surgery and it was successful. It improved her circulation. It improved her endurance. Her condition, it's chronic. There is no cure. It does require costly prescriptions, a lot of medical interventions, lifelong care, really expensive lifetime care. But she's doing extremely well. I mean, she's doing so well. In fact, this summer, we've been home a lot, like most people who are staying safe. She decided she wanted to learn how to swim, and she did. She has figured out how water works. This is after having surgeries for the past couple of years, open heart surgeries. She's been enjoying the water just like any other kid. She's learned to swing on a swing by herself. I mean, in her world, she's just absolutely loving life. And she has such a great personality and such a bright future. It's exciting to be her mother. She's a little lobbyist with me, and that means together we advocate for other children with complex medical needs, disabilities. We're part of a grassroots organization, and it forged just to do what we're doing, responding to the threats posed by this Congress, this presidential administration. So I told you our story, and honestly, it's so hard to sleep at night because we think about the future and all of these uncertainties. We have a lot behind us, but in ways I think back in 2014, when I slept on a pull-out bed next to my baby in a cardiac ICU, I slept better because everything she needed was right there, and no one was trying to repeal her healthcare rights. And that says a lot. So, she was born in 2014. We had great leadership that cared about people and justice and equality and healthcare access. And now it's been under attack the last couple of years for my child, for your life, your family, your friends, neighbors, coworkers. It's frightening. It's really frightening.
Well, elections for sure do matter, and this one more even than most, and for all of you, on the screen, and for so many millions more. But just to imagine the anxiety that one one's child every day, the hope and the worry that all goes together is, for those of us who are lucky enough not to have that, we want to both commiserate and thank you for all that you're doing in the public space to help everyone else. Steve, do you want to tell us your story? You unfortunately also have faced these difficulties at home.
Yeah, thank you very much, Leslie. My story kind of echoes a lot of Andrea's. Unfortunately, or fortunately, I don't know how you look at it, my wife and I didn't know about his condition. He was born in September of 2015, and we lucked out that we had a nurse whose nephew had transposition of the greater arteries. So she diagnosed him at a day old, rushed him to their special care nursery, and he was